Good evening. My name is Nima Hussein, and I'll be chairing this Zero COVID Coalition meeting this evening. Thank you very, very much to everyone joining us, to our esteemed panel, and of course, everybody who's streaming along with us this evening. Today's meeting is titled No Freedom Day for the Virus. We need zero COVID. And of course, today is Boris Johnson's Freedom Day. I wish somebody would let him know and his government know that there is no Freedom Day for the virus. If you would like to join the conversation on Twitter, the hashtag is, again, hashtag #NoVirusFreedom. That's hashtag #NoVirusFreedom. I'd like to welcome our first speaker straight away. So our first speaker tonight is Diane Abbott MP. Diane needs no introduction to regulars at these meetings, as Diane is a co-founder and co-convener of the Zero COVID Coalition. Unfortunately, though, due to other commitments, Diane cannot be with us live this evening, but in this pre-recorded message, Diane will talk about some of the key political issues arising from the government's approach to the pandemic to date.
This Tory government is engaged in a unique and deadly experiment with our health. No other country has done this, which is to try and open up the economy whilst new cases, hospitalisations and deaths from coronavirus are rising rapidly. Even the Secretary of State for Health has now got coronavirus, and this is the time the government wants to drop restrictions and open up the economy. And don't be fooled by the government's false reassurances. The figures tell us that coronavirus is still on the rise, and they've made it clear that they expect hospitalisations and deaths from coronavirus to continue to rise, but they will press ahead with the reopening regardless. The motivating force is a misconceived notion of the so-called needs of the economy, which is just about giving in to the demands of big business. The two are not the same. And we know from experience who will lose out from opening up the economy in this way. We should offer full support for the transport unions, whose members will be put at risk by these dropping of restriction. The teaching unions have a strong case about how pupils and all who work in schools will be at risk. Workers in the NHS are once again made more vulnerable. Black people were hardest hit in the first wave and Asian people hardest hit in the second. Both groups suffered far higher death tolls than the rest of the country. Boris Johnson is telling us he wants to lift restrictions. He's telling us he expects a third wave, but he has no interest in who might be its victims. We should also understand that this policy fits in with the government's entire agenda. This is a government adopting draconian legislation, trampling on our rights. It is authoritarian. This government has launched a fight on ordinary people and the poor. It's caught up in a series of scandals on racism, from its denial of the very existence of racism, for refusing to condemn racist football yobs. And also we've seen its disgraceful treatment of refugees, gypsies, Roma and traveller communities. Remember, this is the government which secretly wants to impose herd immunity policy, but it's also cutting furlough support. It's even encouraging fire and rehire tactics. It has shoved more young people onto the dole, and it's refusing proper support for the self-employed. This is an all-round attack. This government is intent on remaking British society with its attack on working people, the poor, and all those facing discrimination. Public services are being pushed to breaking point, whilst the private sector is being lavished with public money. This government's policies on the pandemic are at the cutting edge of all of its attacks on working people and allow every other attack to take place. We need to attack their policies on COVID on every front. Thank you very much.
Thank you to Diane Abbott for that message. Our next speaker is Professor Robert West, who is a member of both a SAGE advisory panel and of Independent SAGE. Professor West has joined us previously. He will tell us what the government is currently doing in response to rising cases, what it should be doing if it was following the science, and what are the key lessons we could learn from other countries. Welcome, Professor West.
Thank you. Yes, so I want to address this meme that we hear so much about, even from some of my colleagues, which is, if not now, when? As though that was a sensible question. In my view, it's in the running for the stupidest meme so far in this pandemic, because the answer is actually as simple as it is obvious. The answer is when the country has effective mitigation measures. It's really that simple. What are those effective mitigation measures? First of all, we need a sufficient proportion of the adult population fully vaccinated. Now, one may quibble over the figures, but in my estimation, it would be something in the region of 80% of adults fully vaccinated, plus a significant proportion of those under 18s who are among, as we know, those who are seeing the biggest rise in infection rates so far, and that is not without health consequences. Secondly, a proper risk management strategy of the kind that was advised by the behavioral science subgroup that I sit on, SPI-B, back in April. The government sat on this report until a couple of weeks ago, and it has since been launched. I'm very happy to put a link to it in the chat. But it's a risk management strategy, the goal of which, and we were asked to do this, the Cabinet Office commissioned us to write this report, which has since been ignored, as far as I can tell. The risk management strategy, which provides a blueprint for how we can get about getting back to normal in our lives in a way that manages the risk in the same way that we manage other risks in our lives for things that we have to do: transport risk, driving, road safety, safety at work, and so on. There are well-established principles for addressing these risks, and these will have to be applied sooner or later to COVID, and the sooner we do it, the better. And then last but not least, and this seems to have dropped off the agenda of the government anyway, is a functioning test, trace, and isolate program. And it has always been the case, and one of the reasons why we have been so catastrophically bad in this country at addressing this pandemic is because the weakest link in that chain has been the willingness to support people who need to self-isolate, which has meant that even people who believe they have symptoms of COVID, only 20 to 30% of them are saying that they feel able to self-isolate. That was an absolutely catastrophic decision not to give support to those people. Now, as the case rates rise, that becomes more expensive and more difficult. And we then get into a bit of a catch-22, where the numbers of cases are so high that you have a terrible choice. And I see colleagues of mine in the health service who are facing this choice right now, which is, we have so many of our staff being pinged by the app or being told they have to self-isolate. How can we possibly function? The only way of doing it in the short term is to turn a blind eye to the ping, or to reduce the sensitivity of the app, or to say, well, you don't have to self-isolate if you've been double vaccinated. But that doesn't make any sense in terms of infection control. So the answer to the question, if not now, when, is effective mitigation measures, vaccination, a risk management strategy, and a functioning test, trace, and isolate system. So the fact that the government's even putting out that meme, and rather disappointingly being repeated by some of the senior people who are standing on podiums with them, who I think are generally really good people and are in an impossible position. must be a tacit admission that it has no intention of creating the conditions when it would be sensible to open up further. So where does that leave us? Well, the consequences of opening up now are admitted by the government. Catastrophic damage to healthcare because of increased demand and lack of staff because of people having to self-isolate. We're looking at probably upwards of 2,000 hospital admissions a day as this current wave unfolds, and who knows where it will go then, because, I mean, I'm sounding rather doom and gloom, but, you know, SAGE's own modeling says there's huge uncertainty about when we will reach this, the hoped for peak of the wave, and it will start to decrease. Catastrophic damage to the economy and people's lives because of the acute effects of the illness, and of course long COVID, the long-term sickness, and the need for, you know, thousands, hundreds of thousands of people to self-isolate. Catastrophic damage to people's health because of the long-term impact of the disease, which we're now barely beginning to understand, but which is clearly something which is going to have devastating effects in years to come. And of course, not least, the significant risk of spawning mutant variants that will escape the vaccine and natural immunity. It's already the case that the Delta variant has evolved so that it has much better resistance to the vaccine and to previous natural immunity. And that's within the first year or so of this virus. So it is an absolutely foolhardy strategy. So you might think, well, you know, what else could we do? Well, it's not that hard, because we just do what other countries have done and are doing. It's not that we are somehow in the peloton of this road race with other countries. We are an outlier for the, in terms of our national response. And other countries are looking at us and thinking, they're shaking their heads and they're thinking, what on earth is the UK doing? And particularly England. And I'd just like to finish by saying there is another country which is very close at hand, which is doing the level best it can, the very best it can, with some success in addressing this. And that's Wales. If you look at the strategy that's been adopted by Wales in terms of its communication, in terms of its test and trace and isolate system, in terms of the way that it's dealt with cases, I would say, you know, it's been pretty much exemplary. The Wales's real problem is it's shackled to an idiot, and that's England. And so to some extent, it doesn't have a free hand. But I really hope that, you know, we can put enough pressure on the government, through the public, through stakeholders, through organizations, to do the right thing. It'll have to do it sooner or later, and it'd be much, much better if it were to do it sooner rather than later. Thank you.
Thank you very, very much, Professor West. Okay, our following speaker is Professor Aoife McLysaght. One of her previous contributions at our meetings went viral, so we're really delighted to have her back with us again. She will update us on the situation in Ireland, how British government policy is viewed there, and how the two trends may interact. Professor McLysaght.
Thank you very much. Thanks for the lovely introduction. And I'll just say I really agree with everything Robert West has just said. I think we have a very similar situation in Ireland in that, you know, we have failed to do some of the obvious basic things. And in many ways, we have to look at what's happening now as a disaster of our own making. Because if we look back to exactly 1 year ago, all of us were in a better position. In Ireland, it turns out we had actually eliminated the first wave. We had eliminated it entirely. We re-imported it and kept doing so. But, you know, so it is rather striking that a year on, we've actually managed to put ourselves into a worse position by not doing the basics of public health correctly. And so the position we're in Ireland at the moment is that we are, you know, we're watching what's happening in the UK, especially England. And it's very interesting from our perspective to see that you have a mix of both the the best and the worst. So I think you've got some of the best genomic surveillance of COVID globally. You have some fantastic public health doctors and scientists and medics who are contributing to the public discourse. And thanks to the combination of these things, you provided an early warning to the world about the Delta variant. And I think it was in April, mid-April, might have been slightly earlier, that members of Independent Sage and others started warning that this looked potentially to be more infectious and this was going to be a problem. So, you know, as your next door neighbors, we were listening, and a lot of us started saying, you know, well, if it's possibly a problem, we should act now, but no action came. We even had comments that blue skies ahead, and these kind of comments that were very blinkered because the situation at that moment in Ireland was okay, but it was obvious that, you know, if we didn't do anything, this was going to arrive here too. And indeed, the Delta variant is about 80% of our cases now, and our cases have started to rise rather dramatically and quite alarmingly. A few weeks ago, when our modelers first started, like our government advisory group started making their models, they produced a pessimistic option, an optimistic option, and two middle options. And we are worse than the pessimistic option now. So it wasn't pessimistic enough. So looking at what's happening today, so the Freedom Day is freedom for the virus, because that's what's happening. The virus is going to run freely through society, and that's absolutely predictable. And you can see that the cases even went up in anticipation, because people, once they know some restrictions are going to be lifted, they start to relax. So the things, the discussion here is, and what we hear people saying here is that, you know, it's quite shocking, really, what Boris Johnson and his government are doing, and extremely irresponsible. So, and it's irresponsible, and that has consequences not only for the citizens of the UK, but actually more broadly than that. So we're going to suffer too from this, because, you know, we are, because we are also tied to you through a border, through the UK, and in the border in Northern Ireland is a very porous border. And so, and there's also a lot, it's the busiest air traffic routes globally are the Dublin Heathrow route, right? So it's very interconnected. And things that we are worried about, and everybody is worried about, are that not only things are going to go really badly in the UK and here, but that we are going to allow the evolution of a new variant that will have the potential for vaccine escape. So this one is already slightly, evasive of the vaccines, and we just seem to be stacking up the cards in favor of making this worse again and again. And we've taken a problem which was already difficult, and on multiple occasions we've made it more difficult for ourselves. So like I mentioned, last year Ireland managed to eliminate the first virus. We got it, it was gone entirely. We reintroduced it with travel, and then with relaxation of restrictions it went up again. And then we introduced the Alpha variant, the B117, the Kent variant, whatever you like to call it. That came in December. And we eliminated the old one, but then we were left with the Kent variant. And now we know that we would be rid of Kent, except that we've got the Delta variant. So the Irish people, the Irish government speaks a different way than the British government. So our Taoiseach, who's the equivalent of our Prime Minister, basically directly addressed Boris Johnson's comments recently, because he said, we do not want to let it rip. We do not want to let this rise in our population, because we know that there's not only the problem with, we have not completed our vaccination rollout, but that, young people are the ones who are going to bear the brunt now, primarily young people. And we do not want to face the prospect of long COVID in that population. And indeed, the young people are the ones who would be living with the burden of long COVID for the longest, because they have the longest life ahead of them as well. And that's an extraordinary burden to put on them as individuals, but also on the society. So our government speaks a different way, but we have to say that looking at it, they haven't taken those steps that Robert West outlined either. So they have relied entirely on lockdown, which has left the public with a view that this can only be managed by lockdown, which is the most restrictive and most onerous on the people. And they have not done the work that only they can do, which is putting in proper public health structures, properly resourced public health structures, proper risk mitigation that Robert mentioned as well, including ventilation standards and all of these kind of things. So ventilation standards in ordinary workplaces as well as hospitality venues, and all of these things that would make a huge difference. And we know that, or we understand that every government's main motivation is restarting the economy. But if they really wanted to restart the economy, there are things they could have been doing over this last year that would mean that we would be in a good position. So we should be in a position where we could be reopening the economy domestically, and we could be having a much better level of activity economically and socially. The price to pay is restrictions on international travel. But actually, with the vaccines now, had we not messed up so badly, that would have been an easy thing as well, because you would have said that the people who must travel for work must be also vaccinated. That wasn't an option a year ago, it's an option now. So it would have been quite a manageable thing. And so we find ourselves in a similar situation, even though we didn't elect Boris Johnson. I'm going to take a guess, and nobody on this call voted for him either, but he is your prime minister, not ours. But we are also going to suffer from the consequences of his decisions, which are reckless in the extreme. They show, I think, the most generous thing you could say about him is that it shows a deep lack of understanding, because if he understood what he was doing, it would be actually criminally negligent. So I think he can't understand what he's doing, because it's impossible that he would take this step. I think it's going to backfire. I think you're going to find yourselves in restrictions again soon. They're going to have to be reimposed because things are going to go so catastrophically bad so quickly. And that's really depressing to be talking about that so far into this, when we've had obvious steps that could be taken that were there from the beginning. And now, plus we have the vaccines, which we're so lucky to have. So we have vaccines plus everything else. And our government and your government have essentially relied on vaccines alone to put the stress on them, which seems to be as logical as deciding to test your seatbelt by crashing into a car. We're testing our vaccines by crashing into this pandemic and letting it grow. So that's the perspective from Ireland, and it's not cheery, unfortunately. Thank you.
Thank you very much, Professor McLysaght, and I want to apologise for the decisions of our government in negatively impacting Ireland in that way. And I hope that you're right in that the government doesn't understand the consequences of what they're doing, and they're not just criminally negligent. Okay, so now I would like to invite Belle Ribeiro Addy MP to speak. Belle was first elected in 2019 and is a stalwart of this campaign, who has spoken and or chaired many of its meetings. Belle would like to speak on some key issues regarding who is most at risk from the renewed upsurge in cases: poorer people, Black and Asian people, blue-collar workers, and of course, health workers. Belle.
Thank you, and thank you very much for inviting me to speak this evening. I wish it was under better circumstances. The truth is, what the government have done today is engaged in a deadly experiment. It says it's giving freedom to the populations, but it's actually giving freedom to the virus. Tens of thousands of people are becoming infected each and every day, and hundreds are being hospitalized and dozens are dying. But because it's dozens dying, apparently that's okay. This is the time that the government has chosen to reopen and virtually remove all restrictions. And an experiment like this is almost unique. Governments don't usually do things like this. Even this government didn't. And instead, we had belated lockdowns, no effective test and trace and isolate systems, and premature reopenings. Now, we've heard about herd immunity by infection, and no wonder the WHO says this is a product of moral emptiness. We should be clear, because it's not so widely reported enough, that this policy has caused outrage to the rest of the world. And this is for two reasons. Firstly, people overseas cannot believe this government or any government would treat its citizens this way. And secondly, people are inevitably angry because the risk this policy poses to the rest of the world is immense. Allowing a virus to freely circulate with no hurdles whilst the population is only half vaccinated is to turn the whole country into a test group for the development of new mutations. And in an increasingly globalized world, those new mutations will not stay here. But I want to speak tonight primarily about people and the people who are the main victims of this virus. This has different characteristics and phases, and I couldn't possibly deal with all of them this evening. Instead, I'm just going to describe some of the main features. Initially, the virus has been a rich world virus. This is because it was seeded by international travel, and there is much more travel to and from rich countries. It's the same case that countries in North America and in Western Europe account for a hugely disproportionate part of the death toll compared to population size. More than 2/5 of global deaths, despite being only about 1 in 7 of the world's population. Governments in our countries who have resources and expensive health systems have largely inflicted this on the rest of the world. Worse, they're now hoarding the vaccine and maintaining patents on vaccines, so preventing mass production on a global scale. But I know that other speakers are going to talk about this in more detail. Now, numbers of infections and deaths are rising in many much poorer countries. This is a potentially disastrous situation for the global south for a number of reasons. Lower levels of healthcare, poorer, more overcrowded housing and workplaces, and an almost complete absence of access to vaccines, at least from rich Western countries. Now, COVAX is a fig leaf for rich countries to do nothing. Fewer than 130 million doses of vaccines have been delivered worldwide. If I tell you Uttar Pradesh in India has a much bigger population alone than that total, it gives you some idea of how pitiful this support is on a global scale and how disgraceful the refusal to end hoarding is. We even learned today that both Cuba and Venezuela were denied access to COVAX doses. That is a terrible form of vaccine diplomacy. Cases are now rising on almost every continent, and deaths in many cases too, causing political turmoil. A recent rise in deaths in Thailand has led to an upsurge in protests against the government. And as a side note, the surge in deaths in Thailand is very bad, but it is much lower than in this country. So the virus was concentrated in richer countries at first, but in general, they have not contained it and let it spread to much poorer countries. It sounds like many other things that we know. And within richer countries, we also see that it's a disease of the poor. It's poorer people who have died in much greater numbers. In this country, data from the Office of National Statistics shows that you are far more likely to have been infected in areas with multiple indicators of deprivation, or if you're a manual worker, or if you live in a large household, or a home in a multiple occupation. And in short, you're more likely to contract COVID-19 in this country and more likely to die from it if you're poor. This same pattern is evident in the United States and in virtually all of the richest economies, and within rich countries, the virus is also just completely spread and mainly a disease of the poor. Now, in a recent report from the UN, the Runnymede Trust showed, in a recent report for the UN rather, the Runnymede Trust showed that this country is riddled with what is called systemic racism. Now, that systemic racism has two major effects in the area of public health. The first is that Black and Asian people in this country are hugely overrepresented amongst the poor. But the second is that systemic racism reaches into every corner of life, and everyone that is affected and every area that is affected, including public health, education, housing, jobs, pay, unemployment, access to healthcare, and so on. Black and Asian people are hugely overrepresented in the death toll in this country. In the first wave, Black Africans were more than 3 times more likely to die as their counterparts. And in the second wave, it was Bangladeshis who were 4 times more likely to die. Who knows what it will be in this third wave, but I have no confidence that Boris Johnson and his cabinet have given that a second thought. And it doesn't end there. Again, the ONS tells us that 3 out of every 5 deaths in this country were of disabled people. This is a vast overrepresentation, as disabled people actually comprise just 1 in 6 of the total population. These are outrages, a complete scandal on every front, but I don't think for a moment that any consideration was given to any of these issues at all. The government's policy on disabled people is that they should shut up and self-isolate, possibly over the very long term. The Tory government has left behind all pretense that public health policy actually matters, or even that the health and well-being of the population matters. They've made it clear that they expect their policies will lead to a huge increase in new COVID-19 cases, that hospitalisations and deaths will also rise, but they are going to press ahead regardless. Instead, they listen to their own donors across a range of industries. The infamous summary of policy attributed to Dominic Cummings was herd immunity, protect the economy, and who cares if a few old people die. We should offer full support for anyone opposing the government on this, on the transport unions who are extremely concerned about the lifting of the requirement for face masks. We should also listen to campaigners for the disabled and to anti-racist campaigners too. The teaching unions have a really strong case about how pupils and all who work in schools have been treated, and workers in the NHS are once again threatened with being overwhelmed with new cases while struggling with chronic understaffing and underpay. Shop workers too are forced to work in premises where now customers are not obliged to wear masks, which is a massive risk to them. This whole situation is dangerous for the population, but it is politically dangerous for this government. Today's poll in the Times newspaper showed that 55% of people oppose reopening now, and I wonder how many more that will be in a few weeks when infections spread like wildfire. So we need to step up this campaign and many others in the weeks and months ahead. Thank you.
Thank you very, very much, Belle. Okay, so our next speaker, I'm really pleased to welcome Vicky Blake. Vicky is president of the UCU, the Union of Educators in Higher Education. Both staff and students have been treated terribly throughout the pandemic by the government, and in too many cases by management of colleges and universities as well. Vicky will explain to us the current situation and the actions of the UCU in response. Vicky?
Thank you very much for having me, and I hope my sound is okay. I want to start by reflecting that who the government believes they have given freedom to tells you an awful lot about who the government believes people are and who count as people. And I echo the message from other speakers we've already heard and from those who are coming, that the message really is, today is not Freedom Day. I'm going to try and focus in on the picture around post-16 education, which is where UCU represents most of our members, and that's across further education, higher education, and also adult and community education and prison education. And there are some differences across those contexts. But I'm also going to note how fundamentally embedded all of that is in the picture for wider society, because after all, our education institutions are part and parcel of our communities. They're part and parcel of society as institutions where people go to get educated, of course, but also as employers and of sites of training. And it is just absolutely indicative of the mess that we've got when we look at education and how that has been continually mismanaged. And even under the stronger restrictions and even the lockdowns that we've had prior to this point, which I still can't quite believe that we're at today, with people, you know, genuinely out there inherently believing that today is the end of it all. Even before this point with the stronger restrictions, we have had real concerns for the health and safety of our staff, for our students, and the communities that all of us live and work within and commute in and out of. We are now very deeply concerned that the government is not only repeating mistakes from last year, it is exacerbating mistakes and creating new problems. And staff and students are at risk. That then places the people that they love and the people that they work with and the people that they commute alongside at risk in the wider community. And it also disrupts education. And in the long run, that actually widens the gap that is there between those who can and cannot access education. So calling for caution at this point really doesn't cut it. And as others have said, it doesn't really wash to place the responsibility on individuals or even onto individual employers and organisations. It's absolutely imperative that we lower the rates of transmission. We have huge pressure on the NHS We have just the starkest, like it really upsets me to think about the wave of death, quite literally, that is coming, that was avoidable, on top of wave upon wave of death that we have already had. Many people listening to this, like me, have lost people. And many people watching and listening to this tonight also have had coronavirus, have had perhaps long COVID as well. And there are so many more people about to become unwell and about to be suffering from long COVID. We know that long COVID is about 10 to 20% of people who contract COVID. It doesn't necessarily bear any relation to how severely you had the virus in the first place, and the impact that that places on the workforce and within education is something that we really cannot avoid, but which employers seem to be trying to kind of wriggle out of. And I'm getting increasing numbers of queries from our members asking us, how can we support members who are being forced into situations, for example, with occupational health or on capability, where they're not actually able to work at full capacity because they are still months and months later dealing with the impact of long COVID through absolutely no fault of their own. Many of them will have picked up this virus on their way to work or at work. So I think we're in a situation where the Tories are viewing society as a petri dish, and universities and colleges in that situation become the incubators. There are real serious dangers for disabled people and clinically vulnerable people within this, and that also impacts on the fairness of access to education as well. This is not Freedom Day for many people who are now facing impossible choices, and it is increasingly clear to anyone who doubted it that the Tories just don't care about this, because if they did care, they would be doing things differently. And we need to recognise how, still, more than a year and a half on, COVID is still being used also as a veil to push through other cuts and assaults on our rights. And the Police Crime Sentencing and Courts Bill and the Health and Care Bill are two examples of this, but it's happening on every level. It's happening at individual employers as well. Across every sector that UCU represents, we are fighting on multiple fronts against cuts, against threats to health and safety, against threats to jobs. And all of this cross-cuts with the intensification of COVID-19's threat to life and long-term health. And alongside that, we have an NHS under huge burden at exactly the time that the Health and Care Bill is designed to reduce our access to healthcare and let the existing virus of profit motive to let rip further through our NHS. I note that the BMA, our sister union, opposes this, and for very, very good reason. So we're in a situation right now which could feel hopeless if we allowed it to. And I think it's really important that a message that comes out of meetings like this is that we're still fighting this, we're still raising awareness, there is still a battle on the ground, and there are still lives to be saved. There are still lives to be saved in terms of from death, lives to be saved from also the health and financial impacts of this virus. We are in a situation which is the perfect conditions, not only to overwhelm the NHS, but also, as we've heard from several speakers and we'll hear from others tonight, to evolve an escape variant with the potential to be vaccine resistant. As president of UCU, I represent workers across, as I've said, further education, adult and community education, prison ed and HE, higher education. And within higher education, that means we represent leading experts working on all aspects of COVID. That we have a government ignoring them is not our only worry. As we've seen from the case numbers in student populations over the past year and a half, and I was here last summer arguing that we should not be returning students to on-campus and in-person teaching en masse, and that was incredibly dangerous. We have seen employers across higher and further education who have fallen far short of the health and safety measures that we needed and have not engaged properly with us and other unions to establish the workable measures that we needed on the ground. And I note that we have got a branch of prison educators, the Novus branch, and they are distributed around the country. They've taken strike action, they're about to take more strike action. They are fighting for their own health and safety because prisons were for such a long time ignored in all of this, and the cases rapidly grew, and we did not have proper health and safety measures in place for our members there, nor did the unions that represent other workers in those unions, in those prisons. And there are many, many examples, I think, of this in different sectors of forgotten populations. But we've seen in the very sector where the expertise is coming from, still a lack of willingness to engage with that and to really listen, and a lack of willingness to really challenge the government on its inept and inadequate measures at every stage. We really needed students to have brought in a much more sensible approach. They should never have brought student populations back en masse to campus, and it gives us no pleasure to be right that we warned them and what we said would come to pass did. It was absolutely catastrophic. We saw numbers of COVID cases go wildly up in student areas. Very, very serious issues also for students with their mental health, with the impact of having been told that they should come along to campus and move into their campus accommodation and then being isolated there, some, as we saw in the media, in quite prison-like conditions. So throughout, we've seen students being scapegoated against a context of confusing messages from government, with institutions waiting until the last minute for new guidance and subject themselves to intense pressure we think that they should have resisted more strongly, but pressure nonetheless. And we now see staff being scapegoated by well-paid senior managers who have got their fingers in their ears, pointing at the student surveys that are coming out and telling us, funnily enough, that students did not have the best experience over the past year at their universities. We know that the numbers in Manchester were bad in the autumn and have been bad again in June. In Oxford Central, we were over 1,100 per 100,000 cases rolling average by early July, which prompted the council to urge people not to leave the city. In Exeter, in the 7 days to the 23rd of June, cases were up by 192.9%. And even today in some student wards, for example, in Liverpool, we have very, very high case numbers. So the attempt by the Tory government to pin responsibility for what's happening next on individuals and on employers will not wash. Increasing numbers of those of us who've had COVID and those dealing with long COVID do not want to see others go through what we have gone through. We just need to make sure that we're reaching out and connecting those people. We know that the scrapping of public health measures in education institutions leaves campuses at risk of being incubators of COVID, which is going to be a real problem if you're immunocompromised, clinically vulnerable. We need really robust health and safety measures to further limit COVID outbreaks within our colleges and universities, within our prison education settings, and across everywhere. Calling for people just to be cautious will not work. We need desperately clear guidance that masks should remain in place to lower the risk of transmission. And the government needs to quickly change course and meet with education unions to stop scapegoating education unions, to stop vilifying us, to stop planting the seeds of anger towards us in the press, and instead to meet with us, to meet with the education unions, to meet with the National Union of Students and employers so that we can jointly agree safety measures and ensure that students and staff are confident that campuses are safe as they can be and that they're not driving up cases and the loads on hospitals in the areas that we have universities. So I'm going to finish on the note that it is absolutely imperative that the government needs to speed up vaccine rollout. It needs to make sure that students have had the opportunity to receive both doses of a COVID vaccine before the start of the next academic year. And they need employers and unions together with them to be working closely with local and regional NHS providers. And without this happening, students' education and health will be put at risk, which risks, the long-term well-being of a whole generation. And it also risks the long-term health of that generation. We absolutely have to prevent COVID from running rampant through our education settings. And we need employers across all sectors to understand their obligations under equality law. And we absolutely have to take steps to protect those who are clinically vulnerable and others in at-risk categories. And people need to be supported during self-isolation. And that means proper sick pay. That means not being too afraid when you get pinged to observe the ping. That means real support when you're unwell, not trying to work through having COVID from home, not trying to push through when you've got long COVID and making yourself worse. So within the education context, I've spoken about cuts. We have to see a proper settlement in the spending review this year that will reverse cuts in funding and allow a real recovery to take place across further and higher education, remembering that education and investment in education drives recovery of the whole nation. And all of this, absolutely all of this, has to be seen in context of the wider situation and the role that education plays in society. And whatever we can do as a trade union to make links with other organisations and work across other unions, we will do. And that is the only way out of this, because the leadership is going to be down to the people who understand this is a problem. And unfortunately, that does not seem to be the government, and they need to be put under real pressure to understand that from this point forwards. Thank you.
Thank you very much, Vicky, and thank you to UCU and all the pressure that you've been applying on this government, and solidarity to yourselves and all the trade unions who are leading this fight back. Right, so our next panelist has also spoken at our meetings before. Vicky van der Tocht is the international coordinator for the Zero COVID Alliance, which brings together about 30 different groupings in 25 different countries, all campaigning on this issue. Vicky is going to tell us about the development in the Netherlands and in Europe more generally regarding the spread of the virus, as well as campaigning activities. Vicky, welcome.
Hi, good evening, and thank you so much for inviting me here tonight. As you already mentioned, the Zero COVID Alliance is an international COVID response network made up of scientists, patients, parents, teachers, activists, and other concerned citizens. And we support over 40 COVID-focused efforts across the globe by providing accessible information and empowering the general public in making informed health-conscious decisions regarding COVID-19. I was asked to give a European perspective on the phase of the pandemic that we're in and what is unfolding following the full reopening in the UK. Now, let me start by saying that I am from the Netherlands. And while we don't usually make the international news due to the size of our country, over the last couple of weeks we did. Multiple times. And it's because the Dutch Freedom Day was about 3 weeks ago. The mask mandate in indoor spaces was lifted, bars and restaurants could fully reopen. And while you'd say that a full reopening would be approached with the utmost caution, nothing could be further from the truth. So instead of increasing ventilation standards, they relaxed them for bars and restaurants. Instead of making sure that every single case was being traced, now that cases were low, tracing was being scaled down. It was supposed to be a full return to normal. And then a faulty vaccination scheme for the youth was promoted, where our Minister of Health said that you could immediately go out and party after getting the Janssen vaccine, dancing with Johnson. So you can see from our current case numbers how that went. So last week we hit 10,000 cases every day with a population of 70 million. And that is with labs running at full capacity and some having to stop taking new appointments, which means that our actual numbers are even higher. We saw a rise of cases of 500% in 1 week. And at first, hospital admissions following the surge of cases were still low, but we now see that admissions, although delayed by 2 weeks, are going up again too. I mentioned hospital admissions because that is what the Dutch strategy is based on. But we have learned over the last 1.5 years that the effects of COVID stretch much further than just hospital admissions and deaths. The strategy in the UK and the Netherlands is ignoring the serious health implications of long COVID, or at least not doing anything to prevent it. We know that about 14% of all infected people go on to develop long-term symptoms due to COVID that can last for months or even longer, and I'm one of them. Knowing that this high of a percentage of people will have lasting health damage due to infection means that we need a strategy that is based on case numbers, as the current strategy, both in the UK and in the Netherlands, will result in record cases of long COVID. Preliminary data shows that the incidence of long COVID lowers by about 30% with vaccination, and this is great news. But this means that with a quick calculation based on the daily cases in the UK, that the UK-based long COVID support groups will welcome about 3,900 new members soon, and that is only based on the people who tested positive today. Now, like I said, this is preliminary data, but even if the incidence of long COVID is halved by vaccines, that still means that the UK government allows tens of thousands of people to become seriously ill due to long COVID a week. And while it may seem like these patients are now being listened to and get the care that they need, this is oftentimes not the case. Just this morning, I spoke with a mother of a child that is suffering from long COVID, and after 60 months, the only medical care she managed to get was one ECG and to get blood work done. No treatment, no medication, and no official diagnosis. While her kid has collapsed multiple times throughout the last 60 months, is seriously ill and needs help. And this situation is not reserved for kids. Many long COVID patients have been desperately trying to get the care that they need for a long time. And this means that they need to go for examination in the hospital first, a lot of the times. We've heard and read a lot about surgeries and critical care being postponed due to hospitals having to free up space to admit COVID patients. But what is overlooked, in my opinion, is that this also means that a lot of COVID patients who are really sick but do not require admissions also cannot get to the hospital for the care that they so desperately need. With this new wave of not just cases, but also hospital admission, when will it be their turn? When can they go to the hospital? And then there's the situation in schools and daycare facilities. Just a couple of hours ago, it was decided that in the UK, in the age group between 12 and 18, only children with underlying conditions will be able to get vaccinated. Again, with this decision, long COVID is completely ignored. Without sufficient measures in schools in the coming months, most children will be infected. And data shows that a little over 8% of children in that age group develop long-term symptoms. While countries such as Italy, the Netherlands, and France are offering the vaccine to all children over 12, the UK health minister stated this afternoon that the health benefits in this population are small and the benefits to the wider population are highly uncertain. Having met many parents of young children that are sick with COVID, many of whom for over a year, and having worked with the UK-based advocacy group Long COVID Kids since October last year, I wholeheartedly disagree with this statement. And personally think that it's shameful that the health secretary is not taking the health of children into account, not just with regards to the vaccine, but also with the lack of appropriate measures in schools moving forward, such as the implementation of masks, proper ventilation standards, and testing without parents having to lie about symptoms, as not all symptoms in kids are officially recognized. In terms of a European perspective, I can say that our partners and the rest of Europe is closely watching Boris Johnson's every move. He is setting a horrible example that may result in other countries following the same strategy or really a lack thereof. And in this day and age, we are so globally interconnected due to trade and air travel that this decision from the UK to recklessly open up under this virus circulation really poses danger to the whole world. We can only hope that other world leaders take what is unfolding in the UK as a warning and choose to go a different route. I'm keeping my talk a little short because of symptoms that I'm experiencing today myself, but I'd like to finish my talk by shining a light on the support systems that are in place for long COVID patients in the United Kingdom, because I know that they are not really communicated through news broadcasts. So if you're looking for support, do join the Long COVID support group on Facebook. Are you under 18, or if you're a parent of a child with long COVID, do look for the Long COVID Kids support group on Facebook. They will welcome you with open arms and will support you in dealing with this illness, at least as long as nobody else is doing it. I really hope that you do find the support because as a long COVID patient, I know that it is hard to actually get the support that you need. And we will have a lot of new long COVID patients in the next weeks or months. So, thank you.
Thank you very much, Vicky, and thank you for joining us this evening, despite the fact that you've got symptoms and you're not feeling very well. Really do hope you feel better very, very soon. Our penultimate speaker is Dorothy Guerrero of the Global Justice Network, which is campaigning in this area on the issue of vaccine equity. Dorothy will tell us why a very small proportion of the population in the world's poorer countries have received any vaccines at all. Richer countries have been hoarding the vaccines, preventing the waiver of vaccine patents, and seem to have largely squandered the benefits even of that, with cases now rising in many countries. We will also learn about the international campaign for vaccine equity. Welcome, Dorothy.
Thank you very much, and thank you for inviting me to join this panel. I also learned a lot from the other speakers. We are campaigning for people's vaccine because we believe that there is an ongoing vaccine apartheid. So in this global pandemic, everybody's not on the same boat here as we navigate the global coronavirus pandemic storm. Us, we here in the UK is experiencing a gradual return to normalcy, and also in the other affluent corners of the world, countries in the South are experiencing continuation of preventable deaths and deepening poverty because of the pandemic. Many of our partners in the South has been saying that we are happy for you that we see on TV that people can already watch football and rejoice and shout and sing without mask, while we here are still facing death. So it's not actually an expression of envy, but actually it's more of an expression of self-pity, I would say, for many of the people in the South. Because if in the one of the reports that that the People's Vaccine Alliance came up before the G7 summit, rich countries are vaccinating one person every second, while the majority of the poorest nations are yet to give a single dose. So here in the UK, we know that all adults have now been offered the vaccine, and there are now 36 million out of the 67.6 million people, or 54% as of last Sunday, who have been double vaccinated. So in terms of numbers as well, also just to give, just to explain how stark the division is, or the gap is, Britain has given 23 million more vaccines than all of the countries in the African continent combined. So it is easy to say with this situation that it is vaccine apartheid. So while it's Freedom Day in Britain, much of the world is being devastated by COVID-19 because also, and this is where our campaign is, the UK is blocking a people's vaccine. So if we look at what is the rate of vaccination globally, 85% of all vaccinations so far have been in high and upper middle income countries. Just 0.3% went into the arms of people in low income countries. So nearly 100 countries have yet to see even a single dose distributed, while we are already talking here about booster shots or also vaccinating young people. Of course, we know that we have to take care of young people as well, but it is important to think as well that in this vaccine inequity, millions and millions of people are dying in the developing countries, while all of us are almost back to normal. At current rates, this is an important issue. Before the developing world will have our level, or will achieve our level of vaccination, it would need, or it would take, with their level of vaccination, about 57 years to vaccinate their entire population. So that would mean developing countries, or those especially in the least developed countries, would have to wait until 2078 to receive the doses that they need, or be fully vaccinated. So poor and middle income countries, when it comes to death, and this is always the green part, death is not just statistics, it's not just numbers. The number of death worldwide have surpassed 4 million already. And all those 4 million people have families, someone who cared for them, someone they care about. And then many of them are, an increasing number, are also young, who could have had a great future. So 43% and 42% of the deaths worldwide, compared, I mean, in terms of death, those that are dying in developing countries, sorry for the mistake earlier, 43 and 42% of the deaths worldwide are happening in developing countries, compared to 15% in wealthy ones. So as a worldwide death toll from COVID surpasses that 4 million benchmark, there's every reason to believe that the ratio will become even more skewed in months and potentially years ahead. And that is the moral failure of all governments, especially the developed world, or we can say the G7 countries that recently held its meeting in Cornwall. In fact, the vaccinated people in Cornwall the vaccination in Cornwall would be even more than what Africa have experienced already, the whole continent. Of the 1 billion doses pledged by the G7 countries last month, it will not even come close to what the world the developing world needs. The developing countries need 11 billion doses. These are the numbers necessary to vaccinate 70% of the world's population by the end of next year. But they have nowhere of this. There's no sight of these vaccines to come to their country. So when I mentioned that this is a failure of government, including ours, we are supposed to be under the democratic political system. But what is also happening is that in reality, governments, especially in the so-called democratic political democracy, is deferential to corporate power. And I have said that because up to now, the countries of the rich do not consider vaccine as a common good, as a human right. So instead of approaching the pandemic with global solidarity, G7 countries, including the UK, have been unable and unwilling to pursue genuine international cooperation outside the logic of private profit. So profit speaks in this matter. And to think as well that all the majority or a big sum, majority of these countries that are now enjoying high rates of vaccination, all these vaccines that were developed from public money. So all that public money that went into vaccine development come from our taxes. But the manufacturing and distribution of these vaccines has been left entirely up to the market. So each company has its own totally secret recipes and supply chains. And they insist that no other approach is possible. And our government is agreeing to that or letting it happen like that. I will not say that stockpiling is bad. I think countries are behaving like how normal people behave at the start of the pandemic when they bought all the tissue, all the toilet rolls they could get their hands on in the supermarket. At that time, that was, if we compare it to the vaccine, that was when many countries are not yet sure what is the best and most effective vaccine. So that's why the countries, including the UK, ordered in advance. But what I would say as the bad part of it is that those who can afford it can outbid each other, and that is the reason why many of the upper income countries have supplies that are more than that they need. Canada, for example, can have 10 vaccines for each citizens or resident in Canada. Here, I think the rate is like 3 to 5 vaccines per resident here. And many in the South are also pointing at the fact that while we have an oversupply, a big percentage, maybe it varies from each country in Europe, some percentage of the population don't even want the vaccines. So while the rest of the world is waiting for the vaccines and badly needed the vaccines, as we see, the hotspots or the COVID epicenter moved from the developing countries. Before it was in Brazil. Well, on the earlier part, it's in the developed countries like the UK and the US. But then Brazil, and then we had India, and now it's Indonesia. And part of the unfairness here is that I'm using the word unfair, and I would even use the term that given this architecture or the system of trade that we have, it's actually an architecture of injustice, because the countries that stockpile on supplies are the same ones blocking the attempts of developing countries to increase the number of laboratories or companies that could manufacture more vaccines. And they're blocking that through the continuing blocking of the requests by more than 100 countries. This is supported by 60 countries or co-authored by 60 countries. A request by India and South Africa at the World Trade Organization to waive certain intellectual property rights in the TRIPS agreement. So when I mentioned earlier that vaccines are public good, and the TRIPS waiver, the TRIPS waiver campaign that we're launching is following the logic that in the time of global pandemic, we could not put a primacy on the right of corporations or the big pharma to profit. Vaccines are public good. Here in the UK as well, the government has committed hundreds of millions of our money to COVID-19 research and development. So it should use its influence as an influential country and one of the leaders of the world, and as a major funder as well, to ensure that treatments and vaccines produced from publicly funded research are openly licensed to enable any producer to manufacture them and are affordable for all countries. So there are some arguments against this. They're saying that, what about capacity? Not every developing country can have the capacity to produce vaccines. Actually, that's wrong, because there are reports that we also gathered, both as a member of the People's Vaccine Alliance, that, for example, Bangladesh has the capacity to manufacture vaccines. Indonesia, and which is the stark proof of this injustice. Indonesia is the epicenter of COVID at the moment, while Indonesia has the capacity to produce a vaccine. And in fact, before they became the epicenter, Indonesia is collaborating with Sinovac and is producing or in the way of developing, on the road to developing its own vaccine. But then it was too late. The crisis is already inside their house, not just in the doorstep, but inside their house. So with this logic of letting countries that have capacity to manufacture, to allow them so that we have more manufacturers, the developed countries, including the UK, are saying that we will just increase capacity. But that is arguable, because since last December, or when the first rollout of the vaccine happened, it has been proven that the current big pharmaceutical corporations that are manufacturing the vaccine could not supply for everyone, and that this architecture of unfairness will continue if we continue letting the big pharma enjoy its monopoly. The pharmaceutical companies operate monopolies for their products, which also mean they can only sell them, and they are set to at least make billions, 10 billions of one of the market research analysis feature that $10 billion in profits each year from COVID vaccines alone are expected by all these big pharmaceutical corporations. So they expect to make a windfall. And that windfall is based on the fact that they got public funds. So how are we allowing this reality that the government gave them money to manufacture the vaccines, but then the government step aside and let them do the distribution, and at the same time continue to have the patent? No single company can satisfy global demand. So the way to overcome restricted supply is for pharmaceutical companies to share their technological know-how and the rights to make the vaccines with other companies. So the last issue that I would want to discuss is that, of course, there's COVAX, for example. This is a joint facility managed by the World Health Organization. The problem there as well is that COVAX would still need money to buy the vaccines that it could distribute to the developing countries. And at the moment, it doesn't have enough money to buy those vaccines to distribute to the 97 countries that needed those vaccines. So unless we push our government to practice solidarity, to think about other countries, because as what many speakers have already mentioned, as long as the COVID is not checked everywhere, then mutations will continue and it will go back to us. And our responsibility, not just as a powerful country, not just as a rich country, but also an international hub. Any mutations or any variants that will come out from the UK can easily spread all over the world, because we are a travel hub. Everyone, many people use our airports, travel to the UK and travel elsewhere. So they will bring any mutation that they will get here to everywhere else. So thank you very much for this time, and I'm looking forward to the discussion.
Thank you so much, Dorothy. Thank you very much for that. Our last speaker this evening is definitely not our least. The Morning Star is the other co-founder and co-convener of the Zero COVID Coalition, along with Diane Abbott MP. So we are delighted to welcome its editor, Ben Shako, once again. Ben will summarize the global pandemic picture for us, taking in the many points already raised about the role of the richest Western countries in letting the virus surge once more, as well as their role in blocking the sharing of vaccines and even syringes. Thank you, Ben.
Thanks so much, Nemo, and to all the really informative speakers we've had to address this Zero COVID Coalition meeting tonight. It was a very odd scene with the Prime Minister today announcing the lifting of all legal COVID restrictions while he himself was self-isolating. The Chancellor is also self-isolating. The Health Secretary has coronavirus. Business Secretary Kwasi Kwarteng's admission that this is not a great look for so-called Freedom Day is a bit of an understatement. There are more than 50,000 new cases a day in Britain, as we've heard, and hospital admissions are rising. It's clear that the government's claim that it would follow data, not dates, was a lie. No other government is lifting all restrictions so recklessly. Throughout this crisis, the government has been allowed to get away with murder partly because our media hasn't publicised the very divergent outcomes of the pandemic around the world, the far lower deaths and reduced economic disruption found in countries that adopted a zero COVID strategy aimed at maximising suppression of the virus. If the restrictions that we had in place up until today are not actually preventing what's clearly a new wave of the virus, why relax restrictions at such a moment? One reason is that the government is keen to end advice to work from home. That's to protect the value of city centre assets, landowners who own big office blocks and so on, and supposedly also to raise economic activity. Yet in reality, only a minority have been able to work remotely during the pandemic. And if the millions who have to travel into work every day and have had to do so throughout the crisis are not spending money on the high street, that tells us something else. It tells us something about the chronic low pay and long hours endured by the country's key workers. As Aoife said earlier, there are lots of things the government could do if boosting the economy was its priority, not least giving NHS workers a proper pay rise to make up for a decade of decline. If the government hoped to appease a COVID-denying minority, police clashes today with anti-lockdown protesters in Parliament Square show that it hasn't succeeded in that either. And I just want to say a little bit about that movement, this anti-lockdown movement that seems to be taking up more and more sort of space on our TV screens and regularly taking to the streets in protest. I think the left's approach to this movement needs to be quite robust. It's a reactionary, anti-scientific movement. Though hospitalisations are rising, they do remain far lower than before the NHS's vaccine rollout. The proportion of people infected with COVID who are hospitalised or die is a fraction of the figure from January, and that's direct evidence that the vaccines are saving lives. So the anti-lockdown ultras, however loud, don't speak for public opinion. A majority disapproves of the sudden end to legal restrictions. A majority supports an extension of the requirement to wear face masks in shops or on public transport, and to socially distance in pubs, theatres and sports grounds. At the same time, the ironic decision to risk arrest protesting against COVID restrictions on the day that the government has lifted almost all of those restrictions indicates a movement which is motivated more by generalised resentment than by the achievement of specific goals. So mistrust of the state is not illogical. Ministers' mixed messaging and double standards since COVID struck have further shredded the credibility of a political class which was widely, and in my view correctly, seen as dishonest and dishonourable before the pandemic. As socialists, we cannot hold that public anger and suspicion of the government is misplaced. We must rather win people to an understanding that it is being misdirected in an anti-social direction, rather than channeled into challenging the rigged economic system that plunges people into hardship and insecurity. So the government is seeking to pass the buck essentially for rising infections, and this is quite a familiar game. It's calling on people to exercise personal responsibility, exposing millions of workers in shops, transport, and even factories and offices to the consequences of decisions by customers, passengers, and management. As infections soar, it can then blame the public for this, as it did at Christmas in response to predictable travel chaos caused by its own policy U-turns, as it did last spring when ambiguities in its own advice led to people congregating in parks. Labour is right to be opposing this at Westminster. We don't know enough about the long-term implications, as other speakers have said, of long COVID to drop all restrictions while large numbers have not yet been jabbed. And as we've just heard from the last speaker, the government's obstruction of international efforts to waive vaccine patents and inoculate the world also raises the risk of new variants. Remember that Britain is the only member of the UN Security Council which opposes a vaccine patent waiver to allow all countries to produce vaccines. This is an absolute disgrace as the virus continues to spread rapidly in very many parts of the world. But with the Labour opposition about to focus on another round of internal purges aimed at intimidating its own activists, it will hardly be leading the social and workplace resistance to Tory recklessness. The vast majority of the public will indeed show personal responsibility and do their best to protect others from the virus. We've seen this over the past 16 months, but that can't protect people in workplaces from the irresponsible decisions of a minority. So the Labour movement must also show collective responsibility to ensure workers are not put at risk while simply doing their jobs. Employers should be left in no doubt that a lax attitude to safety will result in industrial action, and pressure should be brought to bear on local and regional governments to maintain precautions while infection rates are so high. There's an important role in this process for the Zero COVID Coalition, because so much depends on raising awareness of just how reckless Britain's current approach is, and that a suppression strategy is possible. It has been adopted in a huge range of very diverse countries with great success. It's because our campaign is cutting through that we've seen recent attacks on the Zero COVID Coalition in newspapers, including the Financial Times and The Sun, wrongly implying that suppressing COVID transmission is some kind of impossible fantasy. Now, we're not talking about eradication. I think this point has been made before at Zero COVID Coalition meetings. We're not saying that it's possible to totally eradicate COVID. We are saying that a zero COVID strategy, I think Aoife said this at a previous meeting, is like having a zero fire strategy for the fire brigade. You suppress fires when they break out. You try to make sure you're always trying to bring that down to zero, the number of fires, and that saves lives overall. We've seen it applied in multiple countries with enormous success. This is not a policy which cannot be adopted in Britain. There have been a couple of questions posed in the chat so far on how to change government policy, whether a cross-party government could replace the Tories, whether unions could demand a recall of Parliament after it breaks up for the summer in a few days to change policy. So at the moment, there are clearly not the numbers in Parliament to block the Conservatives. The Conservatives are the big majority. They cannot be forced by other parties to change course. But we have seen this government change course repeatedly in response to public pressure. We've seen it do so over free school meals, over school reopening in January, over teacher assessment and exams. So the pressure needs to be coming from below. It needs to come from us. We can't just lament the government's poor decision-making and leave things at that. We have to campaign to protect people from it. That's what tonight has been about. We need to campaign to raise awareness of the situation internationally, where COVID is still a very, very real threat, which is still mutating into new forms in different countries and still spreading as those new forms spread rapidly between countries, just as the government tries to relax restrictions on international travel, among other things. So that's the task of the Zero COVID Coalition. So I'm really, really pleased to thank all our amazing speakers for tonight's contributions, for another really informative session of the Zero COVID Coalition, to everybody who's tuned in on a beautiful evening to listen to us tonight. So thanks from the Morning Star.
Thank you very much, Ben, and thank you again to all our brilliant speakers and to everyone at home streaming along with us. This meeting has been recorded and will be available on YouTube within the next few hours. If you would like to be kept up to date on future meetings and campaigns, you can find us on Twitter at ZeroCovidNow1 and on Facebook, Zero COVID Coalition. Thank you all and good night.